Hey guys, welcome to Pen Dentistry. Hope you all are doing good. I am Dr. Ayshwarya with you for easy learning and better understanding. And yes, don't forget to subscribe and press the bell icon for the latest upcoming videos. Without further delay, let's get started. Radicular cyst. Today we are going with radicular cyst. It is also known as inflammatory cyst and periapical cyst. Why it is called inflammatory cyst? Because of the inflammation, it is known as inflammatory cyst or periapical cyst due to the periapical region. It is located at the periapical region. That's why it is known as radicular periapical cyst, also known as radicular cyst. Cyst arising from the epithelial residue. The cyst which is arising from the epithelial residues, that is cell rest of malice in the periodontal ligament as a consequences of inflammation, usually following the death of the dental pulp. Where it arises in the periodontal ligament as a consequence of inflammation, usually following the death of the dental pulp. Pathogenesis of the radicular cyst. It is done in three steps: first, second, third. First one is phase of initiation, phase of start, phase of formation, phase of expansion. In phase of initiation, stimulation of the cell rest of malice in response to inflammation of the bacteria infection of the pulps takes place. When there is an inflammation in the cell rest of the malice due to the bacterial infection of the pulp, there is an initiation of the pathogenesis. Direct response to necrotic pulp. It directly responds to the necrosis of the pulp. Phase of the formation. Epithelial cells derive nutrition by diffusion for the formation, for the growth. It need nutrition. So epithelial cell derive nutrition by the diffusion from the adjacent. Progressive growth of epithelial islands move to the innermost islands of the nutrition. Think that it is the epithelial and there are the cells. So the nutrition moves to the innermost cell. So afterwards, inner cell go necrosis. This inner cell go to the necrosis causes lumen or the cavity surrounds epithelial. Phase of the expansion. Breakdown of the cellular debris. There is a breakdown of the cellular debris in the innermost layer within the lumen, which increases the protein, increases the osmotic pressure. Due to the increase of the pressure, increase in the fluid of the lumen takes place. Due to the increase in the fluid, the growth of the cyst takes place. This is how the growth of the cysts or the pathogenesis takes place of the radicular cyst. Clinical features of the radicular cyst. It occurs 50% or more than 50% than all other jaw cysts. In the jaw cyst, it occurs 50% of the jaw cyst. Okay. At the age of 30, 40, 50, that is third, fourth, fifth decade, there is a formation of the radicular cyst. It mostly affect the male. Commonly, male is affected. In maxilla, the percentage of occurrence is 60, and in mandible, the percentage of occurrence of radicular cyst is 40. It involves the tooth that is non-vital. It mostly involves the non-vital tooth detected by caries. When there is a caries, fracture or discoloration, then it seems that the tooth is suffering from periapical cyst. No response to thermal electric pulp. What is when the electric pulp test is done, there is a no response. More symptomatic due to inflammation. It is more symptomatic due to inflammation. It is a slow enlarging, bony hard swelling, and jaw expansion is seen. What there is a seen that it is slow enlarging. Okay, and again Bony heart swelling is seen and jaw expansion is seen. Buccal cortical plates expansion at the buccal expansion and cortical plate expansion in maxilla, and buccal expansion and labial expansion is seen in mandible. Ear bone destruction is also seen. The lesion appears blue in color. There is a pain. Pain? When the pus discharge takes place. Pus discharge takes place on the secondary infection. First, the infection is there, then due to the bacterial or something microbacterial causes, the infection again occurs. This is known as secondary infection, causes abscess formation. This abscess is known as cyst abscess. Why it is called cyst abscess? Because the occurrence takes place in the radicular cyst. That's why it is said cyst abscess. Graphic features of radicular cyst. In radiograph, it is rounded or pear-shaped. Radiolucency at the apex is seen. Radiolucency is more than 1.5 centimeter and less than 3 centimeter. Well-defined outlines with hypostotic borders are seen. Margin is smooth, corticated, and cortex is well defined. Adjacent tooth displaced and resorbed. The adjacent tooths which are placed are displaced and resorbed. Buccal expansion and displacement of the antrum is seen. Infection causes border to become less distinct. Okay, what are the types of the reticular cyst? The first one is apical. It is present at the apical region. Okay, the lateral one, it is placed at the lateral of the apical region, and residual is when the teeth is not present, then at the apical region of the present tooth which was before present is known as residual cyst. The differential diagnosis of the radicular cyst. First one is periapical granuloma, second is odontogenic tumor, giant cell lesion, traumatic bone cyst, periapical cementoosseous dysplasia. What is the management of the periapical cyst, that is radicular cyst or inflammatory cyst? Is conventional root canal therapy. What is conventional? This name is very big. Conventional root canal therapy, not surgical, but it is the same as we have learned before: enucleation, marsupialization, and decompression. To know more about me, links are in description box. And yeah, don't forget to subscribe and like the video.